Now, more than ever, Americans are struggling with their mental health. We've seen increased suicides, increased rates of depression, stress, burnout. Our work is critical to reversing the tide of the mental health crisis that has been escalating.
MHA is a 100-year-old community-based organization working to influence public policy and provide access to care to millions of Americans experiencing a mental illness.
We have 143 affiliates all across the country who are doing direct services in their communities. They're also doing policy and advocacy work at the state and local level. And we have a national office. And our national office supports the affiliates and supports the entire mental health field by providing research, public education, public policy at the federal level, and support for state and local advocacy as well.
Mental Health America's philosophy is that we can intervene and prevent just like we do for every other healthcare condition. We don't wait till somebody has a heart attack to be talking to them about how they can stay well. Same approach to mental health care. How can we get people care really early on? Because mental health is part of health.
We were founded in very early 1900s by Clifford Beers, who was, the term at the time was institutionalized. And upon his release, he wrote a memoir, Mind That Found Itself, and really started what at the time was known as the mental health hygiene movement. The first iteration of MHA is the Committee on Mental Hygiene. And over the years, our names have changed, and we've come to be known as Mental Health America. But throughout that entire time, this idea of prevention, of early identification, you can go back to the documents and see that in his writing. The recognition that it was a different time, but we needed to recognize the inherent humanity of people who were living with mental health conditions, and that we needed to do better by them.
To this day, we know that the people who have themselves experienced the mental health conditions that we would like to address are the most important voices to guide us.
One of the things that really kind of echoes that is this bell behind me. The bell is 300 pounds of chains and shackles that were melted down and forged in a foundry up in Maryland.
Our focus on addressing issues before a point of crisis is tied to the idea that the earlier we identify an issue, the more likely it is that we can help guide individuals towards preventative resources and guide them towards opportunities to find support based on what they need.
We work in workplace mental health. We do massive public education efforts around the country. We're always working on community outreach efforts with partners at the national level and at the local level. We do a lot of work to support our affiliates and the various needs that they have.
One of the things that we offer, of course, is a free and anonymous screening program on our website so that if someone is concerned about themselves, they have an opportunity to take a mental health screening that will give them more information about what they're going through. The other thing that we want is to link them also to resources and information. Something to read, something to watch, or somewhere to go, perhaps in their local neighborhood. Most important thing that we want them to get in all of that messaging and in those tools is that there's help and there's hope, and we are here to support them in that journey.